This week on Jersey Matters, are we looking at another shutdown? Dr. Brian Strom from Rutgers University says everything should be on the table if COVID cases keep going up. One of New Jersey's top chefs says the hiring crisis at restaurants is still a big problem. We'll talk with Chef David Burke. Candidate for Congress Tricia Flanagan says no one should have the right to ask you if you've been vaccinated. And one of the stars of the hit reality show Naked and Afraid is from New Jersey. We'll talk with Medford's own Danny Bowe. Hello and welcome to Jersey Matters. I'm Larry Menti. The Delta variant of COVID-19 has created a rise in cases in New Jersey, and health officials in the state are getting concerned, including Dr. Brian Strom, Executive Vice President of Health Affairs at Rutgers University, who predicted this surge when he appeared on Jersey Matters 3 weeks ago.
We will probably have a surge in 3 weeks because the Delta variant. July 4th combined with the Delta variant together. Hopefully a very small surge. We will hopefully never be back where we were.
Doctor, thanks a lot for joining us again. We're having you on because you made a prediction the last time I talked to you a few weeks ago. You said, watch, a couple of weeks after the 4th of July, there's going to be a rise in cases, and now there's a rise in cases in every state in the country. So I'm sorry to say you were right. I wish you weren't. What can we learn from this?
Interesting question. So first, let me back up. In January 2020, when the pandemic was only an epidemic in China, I predicted 500,000 deaths, and people thought I was crazy. It was an underestimate. I didn't predict the incompetence of some of the leaders, but unfortunately, this isn't rocket science. What can we learn? That science matters. That things are reproducible, I have predicted, and I'm certainly not, I don't mean to say this is uniquely me or I have a magic crystal ball or anything. As an epidemiologist, the course of this is foreseeable. As long as we're not mostly vaccinated, we're going to have these problems. And part of it, which makes it worse, is that as long as, so far the vaccines have worked against all other variants. The variant, but all the unvaccinated people are what one of my colleagues has called a variant factory. That this will continue to mutate. That is the nature of viruses. It will continue to change. And at some point, we risk it changing into something the vaccines don't work against. And then we're back where we were last spring in terms of the pandemic. I think we released the public health measures too quickly, particularly with Delta on the horizon. My guess is over the next few weeks, things are going to get worse and then better again. We're not going to go back where we were in the spring, certainly not in New Jersey, because we're one of the best vaccinated states in the country. But next few weeks, 2 weeks after the exposures, you get cases. That's what happened. 2 weeks after that, you get hospitalizations. That's happening now. And 2 weeks after that, you get the deaths. And that is a completely foreseeable, we've seen that now for a year and a half. That's what we will see over the next few weeks. But because we're outdoors, at least in New Jersey, it's then going to start improving. We then will see it again 2 weeks after Labor Day. That same sequence, but because we'll be moving indoors at that point in the fall, it's going to get worse, and it'll stay worse and continue to get worse. If we don't get people vaccinated, more people vaccinated between now and then. There's a reason New Jersey is in much better shape now than Missouri, which is like New Jersey was last spring. Hospitals overwhelmed, they don't have enough oxygen, and so on. We have a substantial proportion of our population vaccinated, but not large enough to it blunted it, but it didn't kill it. And we need a much larger proportion of the population vaccinated.
Yeah, I was going to push back a little bit on what you said about New Jersey, because we're nowhere near the numbers that people say we need for herd immunity. And certainly there's been a rise in cases. And if you are correct, there will be a rise in deaths now over the next couple of weeks. And so that isn't a wake-up call for New Jersey?
You would hope. But there's still people who are resisting it. I think we risk having to go back into lockdown. And it depends on how well the existing vaccinations blunt that. So let me back up. My prediction earlier on was that after Memorial Day, 2 weeks later, we were going to have another peak. And how far we would go in that peak would depend on how well the vaccinations worked. But that after July 4th, it would be much worse because now we'd have the Delta variant, which is dramatically more contagious. People don't understand. Delta variant, not only do people infected with the Delta variant presented day 4 instead of day 6, but when you culture their respiratory tract, the breathing, where they breathe, the amount of virus compared to the original virus from a year ago is over 1,000 times higher. There is that much extra virus when people get infected with Delta. So what it means is this issue of 6 feet and 15 minutes and all the protections we thought about before are out the window, because you pass people casually and you risk getting it if you're not vaccinated. And yet the vaccine works. And so it works extremely well. Again,
well, you're hearing more and more cases, doctor, of people who got the vaccine coming down with the Delta variant. So yes, it works to a certain effect, but it doesn't seem like it worked on the original virus as well.
Yeah. So yes. But let me clarify that. First, no vaccine is perfect. No vaccine protects against all disease, even against the original virus. The mRNA vaccines, the Pfizer and Moderna vaccines, were 95% effective. It means 5% of people were going to get sick. When you start with a very large number, 5% is still a large number. It doesn't work quite as well against Delta as it works against the original, exactly as you stated. But what it does do is it protects against hospitalizations and death. Now, well over 99% of the people now in the hospital or dying are unvaccinated. So it doesn't prevent you from getting infected. Mostly it prevents you from getting symptomatic, but not 100%. But it prevents you from getting sick enough to be in the hospital or die. So if you get infected, even after the vaccination, you may pass it on to other people. So you are at risk even if you're vaccinated, if you are infected, even if you have no symptoms, you're at risk to the people who aren't vaccinated. So, for example, I'm on the hospital board, Robert Wood Johnson University Hospital board. And as we went back to our first board meeting, when I talked to the management about finding out if people are our first in-person board meeting, finding out if people are vaccinated or not, they were uncomfortable asking. So I, as a board member, sent out an email going, I'm vaccinated. If I come in person and you're not vaccinated, I put you at risk. So I don't want to come if people aren't vaccinated. The people who aren't vaccinated shouldn't come and be in person with other people.
It's amazing that people are uncomfortable asking that. It's the first thing I ask if anybody comes to my door, are you vaccinated? Because many decisions have to be made right at that moment. And so you can't make the decision unless you have that information. Let's talk about September.
Yeah.
When things are going to open up, businesses want to open up. They want to bring employees back. Schools want to get back to normal. Universities like Rutgers want to get back to as normal as possible. Does this put a kink in all of that?
Yes. Depending on what happens between now and then. And it depends on the vaccination rates between now and then. Do we do a better job of vaccination? We would like to, as a university, be able to open up in September, the students all vaccinated. That requirement is in place. And staff, we're strongly urging to be vaccinated. I just sent, as the chief medical officer for the university yesterday, an email out that when somebody reviewed it before I sent it out, going, can we tone it down? This is very scary. I said, if you find it very scary, you got the message. We would like to be able to open saying that anyone who's vaccinated can go mask-free. Anybody who's not vaccinated should wear a mask. And whether or not that is doable will depend on what proportion of people ultimately get vaccinated.
And you'd have to know who's vaccinated and who's not vaccinated. You necessarily have to ask that question.
Well, we're trusting them to self-identify in that model, recognizing that if you're unvaccinated and you go without a mask, you're the one at risk of dying. because this disease, again, one of my colleagues said, not my line, if you're unvaccinated, Delta will find you. This is an incredibly contagious version of the disease. And it's affecting young people. It's affecting if you look in Missouri, a large proportion of the hospitalizations and deaths are now young people. And so, being young doesn't protect you here. It's lower risk, but it's far from zero. Young people are dying from this disease. People need to get vaccinated. And that'll determine what September looks like. Because otherwise, come 2 weeks after September, we're going to have another surge like this, followed 2 weeks later by hospitalizations and 2 weeks later by deaths, and nothing to blunt it, because it's no longer outdoors.
So let's qualify this. What are you looking for exactly? Well, over the next month or so, if cases still continue to rise in New Jersey and across the country, you have a decision to make about whether you open to all students, whether you go virtual again, whether everybody wears masks. What are the decisions that have to be made?
I think all of that. So yes, to all that. I mean, the last thing we'd want to do is go all virtual again. It's why we asked the students to all be vaccinated. They should be protected. The question now is faculty and staff. If we can get enough faculty and staff vaccinated, we'll be fine. If we can't, then we may need to move to all masks. We need to full masking. Right now, the rules of Rutgers are still fully masked.
Wait a second. So you're saying the people that teach the students and are supposed to be the examples for the students are the ones you're having the most trouble with?
They correct. They are not mandated. We cannot at the current time. We've been unable to mandate that they get vaccinated. We are very, very strongly encouraging it. My scary email from yesterday was about that. And the students are very appropriately asking why you require it of us and not of the others. And it's a very appropriate question. And the faculty and staff are at higher risk because they're older than the students. So, but there are legal and other restrictions that make that harder. And so we are strongly urging that everybody get vaccinated. We've sent surveys out of the proportion of people who've answered the survey, faculty and staff, 95% are vaccinated. But a lot of people haven't answered, and we're worried about the people who haven't answered, and many of them having not been vaccinated. Realistically, again, if somebody says they're vaccinated and they're not, the person who's most at risk is themselves.
Right.
And because they're the ones who are going to get sick. They're going to get sick over the next few weeks, most likely, as well, because they're not vaccinated.
Well, it sounds like things could change weekly. So if you don't mind, we'd like to check in on you again. You have a wealth of information. Thank you so much, sir. Dr. Brian Strom from Rutgers University. Still to come on Jersey Matters. There's still a hiring crisis in New Jersey. Chef David Burke, one of the top restaurateurs in New Jersey, tells us how he's coping next.